Welcome to the Voluson Performance Series video tutorials. Doppler optimization. Color and pulsed wave Doppler are important tools in assessing hemodynamics. Be sure to use the appropriate image preset, as Doppler settings are optimized for each preset. To visualize blood flow, activate Color Doppler by pressing on the CF control knob. Power Doppler and high definition flow can be accessed from the display menu on the monitor. This and all other display menu items can be activated by selecting the shortcut key indicated on the left, or by turning the navigation control knob to highlight, then pressing the knob to activate. HD Flow provides excellent sensitivity and resolution with the added benefit of directional information. Once Color Doppler is activated, adjust the region of interest, or ROI box, to the anatomy of interest. Both size and position are adjusted with the trackball. The upper trackball key toggles between the functions. Reducing the ROI box size to just the area of interest will help improve frame rate. When optimizing color, first increase your Doppler gain to the point of noise, then decrease slightly so the color is maintained within the anatomy. Once the ROI and gain are fine-tuned, adjust the pulse repetition frequency as needed. Lower the PRF to display slower velocity flow. Increase the PRF to display higher velocity flow. To maintain a real-time appearance when looking at the blood flow, it's important to keep the frame rates as high as possible to appreciate the dynamic flow. For instance, flow in the umbilical cord is not as fast-moving as flow in the fetal heart. So, in the fetal heart, try to optimize the image to have as high a frame rate as possible. To improve frame rates, reduce the B-mode sector angle and depth prior to activating Color Doppler. Reduce the ROI box size to increase frame rates. To activate HD Flow, select the Color Doppler control knob, then select HD Flow from the display menu. Pulsed wave Doppler is used to calculate the flow velocities. To activate pulsed wave Doppler, press on the PW control knob. Place the sample volume gate within the vessel of interest. Activation is done with the trackball keys. Simultaneous allows B-mode, color, and pulsed wave Doppler modes to run simultaneously. However, the trade-off is that the quality of the spectrum is not as optimal since the system performs all tasks at once. Update mode freezes the B-mode and color Doppler modes to focus all of the system's processing power on the spectral waveform. If adjustment of the sample gate is needed, the system intuitively stops the spectrum and provides a live updated B-mode and color image so that the proper placement can be achieved. The system automatically goes back into the update mode once the trackball stops moving. Pulsed wave Doppler's PRF functions similar to the color PRF. Toggle the PRF down to display lower velocities and toggle up to display higher velocities. Pulsed wave Doppler's baseline is adjusted by a rotary knob below the keyboard. Rotate the baseline control knob to correct the spectral Doppler waveform for aliasing. To invert the pulsed wave Doppler spectral waveform, select the Invert hard key on the console. Auto Optimize is a quick single hard key selection to aid in spectral Doppler optimization. Select Auto Optimize when the spectral Doppler is active. The system will automatically adjust the PRF and baseline. The system listens to the signal for a few cardiac cycles and then adjusts accordingly. The system can be programmed to automatically enter calculation mode in freeze. Once you freeze the pulsed wave Doppler image, the Calcs menu appears on the display menu to choose the vessel, and then walk through the points to measure. You can also select Auto Trace, which will put a trace over the entire spectrum. You can readjust the trace by selecting the Change key on the trackball and moving the trackball to fine-tune the selection. Measurements will be placed into the patient's report. To perform a manual calculation, select the Measure key to see Generic on the display menu, then choose the measurement. To program the system to have calculations come up automatically in Doppler, select the Utility key, select Measure Setup, then the Applications Parameters tab. Confirm the correct application, then make choices from the drop-down menu. This can also be done for M-mode calculations. Motion mode, or M-mode, is used to measure the fetal heart rate. To activate M-mode, press on the M control knob. When you freeze the M-mode timeline, measure the fetal heart rate by selecting the Measure Hard key, then selecting Fetal Heart Rate from the display menu. Use the trackball and set keys to place the calipers for measurement. The Voluson Performance Series is an easy-to-use system with excellent image quality and performance to help meet the needs of your practice.